Hello, this is Mayor Hatem. I want to share with you a few brief remarks and then answer several questions that have been submitted. Although the COVID-19 pandemic continues to spread throughout our nation, it is at a slower rate. The public health measures of mitigation, physical distancing, wearing a mask, no large gatherings, allowing only essential businesses to remain open, no dining in at restaurants, hand washing, are making a difference. It takes weeks to see the results. And though it is encouraging, as Governor Cooper stated in his recent press conference, now is not the time for complacency. We must remain vigilant and continue Southport Stay Home and Southport Stay Safe. The governor also stated that the, and I quote, wholesale lifting of the orders would be a catastrophe, end of quote. We must resist the pressure to reopen until cases are markedly lower and that testing for the virus, antibody testing for immunity, is available, which will allow for case identification, isolation, quarantine, and contact tracing of all COVID-19 cases. There will still need to be social physical distancing, wearing masks, prohibiting gatherings in large crowds. I want to thank the citizens of Southport who have been following these public health measures, and I appreciate the local businesses who have patiently abided by the emergency declarations and executive orders. I know this causes great hardship. Our economy will return, but we can only begin to reopen in stages when it is safe to do so. We will know more in that regard towards the end of April. I am grateful for your patience as we continue to adjust to life during this COVID-19 pandemic. Before I answer questions, I would like to read a public notice that was placed in a newspaper. Notice is hereby given that in order to prevent the spread of Spanish influenza, all schools, public and private, churches, theaters, moving picture halls, pool rooms, and other places of amusement and lodge meetings are to be closed until further notice. All public gatherings consisting of 10 or more are prohibited. 19th of October, 1918, D.W. Sutherland, Mayor. And locally, from the Southport Pilot, Dr. D.I. Watson, acting physician of the U.S. Public Health Service, posted a letter in the Wilmington Morning Star requesting that the people of Wilmington and Southport not travel between the two cities for the time being. He also asked that only urgent business be conducted in order to reduce the chance of spreading the disease between the two cities. Also from 1918. As for our questions today, we have two. One is, I thought viruses cannot respond to a vaccine, only bacterial infections. Explain. Very good question. As you know, vaccines create immunity in the body, and they can be used not only for viruses like polio, shingles, of course the vaccine that's being developed against the coronavirus. And it also can be for prevention of bacterial infections. We're all familiar with the pneumonia shot that's given at a certain age. So vaccines work to prevent both bacterial and viral diseases. That's a very good question. Thank you. What you may be thinking about is that antibiotics usually work against bacteria, but not against viruses per se in that regard. Next question. What is your position on wearing masks? Again, this is very important, and we've had a number of questions on this. It's the recommendation of the CDC that we should be wearing a mask when we're out. I wear one when I'm running errands. Of course, I wear one at the hospital. And this is the way that we protect ourselves, and particularly how we protect our neighbors, our friends, how we protect each other. So I encourage everyone, when you are out, to please wear a mask. The homemade cloth mask is perfect for that. So I thank you for these questions. So I hope everyone continues to do well. I appreciate your patience in following these public health measures. I want you to stay safe, stay home, stay well, and remember that by doing so, you are the heroes that will be saving lives. Thank you.